Welcome to KOCT's North County Roundtable. I'm Kent Davy along with my colleague Alison St. Today we're going to talk to people in 3 of North County's major healthcare providers to find out how they're handling the COVID-19 crisis. We'll hear from Palomar Health, Scripps Health, and Tri-City, all of which have hospitals here in North County.
We'll ask if they've got enough beds and trained staff to take care of you if you need it, what kind of after effects you might expect from a vaccine, and how much longer this could go on. This is a fast-moving situation, so we should note that this is being recorded on January 21st. The latest numbers show that in San Diego County, over 200,000 people are confirmed to have contracted the virus and over 2,000 have died. Over 8,000 are in hospital and over 1,000 are in ICUs. It's unclear how many people in San Diego County have received the vaccine so far, and as of now, there is no North County venue to administer vaccines.
Our first guest is Dr. Sandeep Soni, infectious disease specialist for Palomar Health. Welcome, Dr. Soni.
Thank you. Thanks for having me.
Can you describe for us your organization's status with both the vaccine delivery and the hospital bed, particularly the ICU beds?
Sure. Over the last, I'd say 6 weeks after the Thanksgiving holiday, we have been this is the 3rd surge, if you will, for San Diego County, have had issues with capacity within our ICU, more particular after that holiday and into the new year. We are full in the ICU, and in fact, have had to expand beyond the ICU to provide ICU care at Palomar Health. Our vaccine rollout started prior to the new year. We were able to administer our first doses, probably one of the first hospitals in the county to get going, because we did have a low temperature freezer to store the Pfizer vaccine, and our pharmacy department, employee health department, along with the medical staff, have been great to create a system to get the vaccine rollout. So up until now, we've had about 5,100 doses already administered within our institution.
So now, I had said earlier that there is no county-based venue to administer the vaccines like there is in Petco Park down in San Diego, but obviously you at Palomar and some of the other hospitals have been administering them individually to your own staff and to certain people. Do you have any knowledge of when the county might open something more open to the general public?
I think all of us are waiting for the county to open up. I don't have any inside information. I know earlier today there was a message that went out indicating that hospitals, once given approval, can start giving this to patients over 65 and above. That is the next phase that will open up. So we've been eagerly waiting, because I feel like we want to help our citizens in our county as well.
For people who are inside your coverage area, how would they approach getting a vaccine appointment with you?
So Palomar Health has applied to have the Graybill Clinic side and the Arch Healthcare Clinic side be secondary sites for vaccination. We have been still waiting for approval for that to happen, so that our allotment of vaccine that we receive for Palomar can then be distributed to those clinics to be utilized. Right now, we've only been given approval to use that allotment of vaccine for our healthcare providers.
At this point in time, are you in a position to start vaccine process for beyond your staff and support staff?
We are ready. I think our goal would be to get it to the clinic side so that the patients and the staff in those clinics can start to get vaccinated. So that is the goal, is to get it out to the Graybill Clinic, which covers a large area of North County, as well as the Arch clinics as well here in Escondido and Poway and Ramona, so that they have access to the vaccine and their patients have access to the vaccine. But again, we're limited because we didn't buy these vaccines. These are, going through the county to us, so we're following the rules.
Understand. Do you have a sense, or can you give us a sense of, is all of your staff, medical staff, as well as support staff, been vaccinated at this point, or do you still have a ways to go there?
With that number I gave you, we're at about, if I take the medical team, the doctors and the nurses and combine them, we're at about 70%. Our physician vaccination rates are in the 90 percentile range. And so we're getting there. We still have clinics that are open up until the end of February to come get your vaccine. So we're hoping to keep pushing the envelope and getting higher numbers.
Have you had some resistance by staff to saying, I don't want it?
You know, we haven't required a declination form similar to the flu. It hasn't been something that's been mandated. So we've done a lot of town halls to educate folks, myself included, to make sure they understand how the vaccine works, what are the side effects for this particular vaccine. We've done question and answers twice, or 2 town halls already, and I'm always available as well, and so is our pharmacy staff to answer those questions. So, it's a new vaccine, so there's obviously some hesitation. We have different providers with different levels of medical conditions and so forth. So I would say there hasn't been overall obvious resistance, just some caution.
The thing is that right now you probably haven't got enough vaccine to vaccinate all the people who would like it. But at some point, there will come a time where those who are hesitant to take it will need to be educated. What would you say to people who are feeling cautious and are worried essentially about the side effects?
No, sure. I mean, listen, it's a novel vaccine, so it's definitely understandable. We're trying to do our best to educate with the data we have, and the data is still very new and very fluid, and as the days go on, we keep getting more data. So for those who are hesitant, I still recommend the vaccine, but we've tried to do even one-on-one counseling with several of our staff to make sure that they are aware of the side effects, take into consideration any concerns they've had. We have, in certain instances, had to pre-medicate people because they really wanted the vaccine, but they had underlying medical conditions. So we've taken it down really to the individual level between myself and the pharmacist to ensure we get a good outcome.
What would you say to, say, a 20-year-old? I'm 70, so it was like a no-brainer. I'm going to take the vaccine as soon as I can get it. A 20-year-old might be looking at this and going, well, this is a novel vaccine with mRNA. We don't know, because it's novel, what it will do to a human being 40 years from now. What do you say to that kind of a question?
Yeah, no, it's a good question. If I had it my way, it's the 20 to 29-year-old population that is unfortunately carrying this virus and spreading this virus, if you look at San Diego County's numbers. But they're healthy individuals. They're not passing away from the virus, but they're certainly spreading it to not only people amongst themselves and their age group, but I think that's how it gets into our elderly population. So you have to, these people go home to grandma and grandpa eventually, or they meet their mother and father, and it spreads from there. So I highly recommend it. I think, look, there are going to be side effects that we have to contend with. So far, with out of finishing the phase 3 trial, where you're only at 30,000 patients involved and only half received a vaccine. Now we're in the millions of people who have received a vaccine with there are some case reports of anaphylactic reactions, but that's the definition of that can be looked at. But no serious adverse effects that we have seen, no major adverse effects. But this disease can cause death quite quickly, especially obviously in the older category age group, the mortality rates are higher, but the spreaders are that younger age group, in my opinion, and we need to vaccinate those folks first. Not first, but they're high priority, in my opinion.
Yes, that's a very good point. I mean, could you be specific and transparent about the side effects so that people who feel like perhaps they're not being told the whole truth?
Yeah, sure. I mean, I've had 2 shots myself. So, obviously the injection site is the biggest one. It hurts, for about 24 hours, but, within 24 hours, kind of like a tetanus shot, it goes away. The pain goes away and your arm feels better. Fevers, chills, myalgias, meaning feeling fatigued, are the biggest side effects, and more common with the second dose. So because your body, the first time around, doesn't know what happened, but the second time around when you get that shot, it realizes that, oh, that's the same protein you put into me 3 weeks ago. So now I know what to do and I know how to react. And one caveat is if you've had COVID and now you're going to get your vaccine, that first shot behaves like the second shot because it's already realized you have that protein within you. So that's a good caveat to remember. But the second shot for most of us was probably the harder to tolerate. Interesting enough, in the studies, those who were over 55 years of age did better. We don't know exactly why, whether they're just tougher built and complain less versus their immune system being a little weaker, so the response wasn't as strong. But fevers, higher grade fevers could occur up to 103 degrees Fahrenheit, 104 degrees Fahrenheit, but it's short-lived. It's 24 to 48 hours. Rashes have developed in some folks. In the studies that they did, the only neurological complication that they saw, and they weren't sure whether it was related to the vaccine, and we still don't know, was something called Bell's palsy, which is a facial nerve paralysis. But the incidence was not any different from the general population. So they're keeping an eye on that in particular. And there's a hotline there's a website and an app that we tell our patients when they come in, our staff, to report their side effects profile too if something does happen, something serious does happen. So Pfizer and the government, et cetera, are keeping track of this.
Can you give us a sense of your understanding or your best guess as at what point in time or at what percentage of our total population is going to have either had the virus itself or a vaccination for the positive effects of herd immunity to start to show up?
Yeah, I'd probably agree with Dr. Fauci, who's been out there and saying 70% and above. And I think that's probably the sweet spot. I think you're going to need about 70% or higher to be able to hopefully get life back to normal.
Do you have a quick prediction of when that might be, 70%?
I think it's still going to take us a good 12 months.
Well, thank you, Dr. St. We are out of time. Appreciate your coming on with us.